Hello students, this is a very short presentation on the queries that were asked in our previous lecture, that is humerus shaft fracture. Uh, there were three queries that were asked. First was how are nerve injuries treated, and second one was can we use hanging calves anywhere else, or is it only used for humeral shaft fracture? And third one was is classification, do we have to explain all of them in exam, or should we mention all the names only? So first we'll discuss about nerve injury management. Actually, nerve injury is a very vast topic which must have been covered in your previous lectures. I'm just going to cover the management part. For understanding the management or a treatment of a nerve injury, we are supposed to be knowing about the classification. So there is a very simple classification given by Seddon for nerve injury. He divided the nerve injury into three types. First one is neuropraxia, second one is axontomesis, and third one is neurontomesis. So to understand what is neuropraxia, axontomesis, and neurontomesis, we need to understand what is the structure of a peripheral nerve. So this is your peripheral nerve, or for example, if this is a radial nerve, or ulnar nerve, or a musculocutaneous nerve. This is a nerve, complete nerve. So it consists of a sub basic structure. The most basic structure is the axon. This conducts the electric current from spinal cord to the muscle. So the most basic structure is axon. The axon is covered by the endoneurium. A group of axon with endoneurium forms a bunch which is covered by perineurium. A group of perineurium forms a bunch which is covered by epineurium. So this is your basic structure of the nerve which you need to understand for understanding the Seddon's classification. So axon is the most basic structure. It is covered by endoneurium. A bunch of endoneuriums form a bunch to be covered by perineurium. A bunch of perineurium are covered by epineurium. This is the outermost structure, epineurium. So in neuropraxia, what happens is there is no damage to the nerve fibers, no damage to the axon. This axon is very important. So if axon is intact and endoneurium is intact, it is known as a neuropraxia. It usually occurs in a contusion or compression injury. Contusion or compression. So when there is outside pressure, but endoneurium and axon, this is endoneurium and this is axon, both are intact, then it is known as a neuropraxia. Then coming to axontomesis. Axontomesis, difference between neuropraxia and axontomesis is the axon is damaged. That's why it is called axontomesis. That is damage or cutting down of the axon. The axon is damaged, but endoneurium is intact. So when the axon is damaged, the part distal to the nerve injury. Suppose here is the injury. The part distal to it will undergo degeneration, which is known as Wallerian degeneration. But the beauty of this injury is that when this part undergoes degeneration, it is resolved by the macrophages, and then there is a regeneration as the endoneurium is intact. There will be a regeneration from this part and here also. So this injury can be reversible. It is not always reversible, but it can be reversible. The third type of injury is neurontomesis. In this, both the axon and the endoneurium both are damaged. So there is no chance of any regeneration. The part distal to this undergoes degeneration, that is Wallerian degeneration. There will be no regeneration, no spontaneous regeneration. So this type of injury will require surgical intervention. Coming to the treatment, so if it's a neuropraxia, then only treatment we need to do is observation. We have to observe the patient with and allow and give him immobilization and advise him physiotherapy after the regeneration occurs, or sorry, after the recovery occurs. Other types of conservative therapy is TENS therapy, that is transcutaneous electric nerve stimulation. We can stimulate the nerve. So in neuropraxia, no surgical treatment is required. The only treatment is observation and physiotherapy. That is the transcutaneous electric nerve stimulation. In axontomesis, only the axon is damaged, endoneurium is intact, but the nerve can undergo regeneration. So we first look for any signs of recovery. We observe the patient. We don't do any active treatment. We give him physiotherapy. If the recovery occurs, then nothing needs to be done. If there is no recovery, then we can either do a nerve repair, we can either do a nerve graft, or we can do tendon transfers. If it's a neurontomesis, that is both the axon and the endoneurium is damaged, then we have to undergo, primarily on the first day we have to undergo nerve repair. If the nerve repair is not possible, which can happen in cases when there are open fractures and the large chunk of nerve is lost, then we can treat the patient with nerve grafts. And if we see the patient after 3 to 4 months, when the nerve ends are very retracted or the nerve loss is too much, then we can do tendon transfers. So this was regarding treatment of the peripheral nerve injury in brief. And now the question that was asked about hanging cast. Hanging cast, it is for all practical purposes is used only for humerus shaft fractures. If anyone asks you about hanging cast, it has to be said regarding humerus shaft fractures only. In the past, for some cases of intertrochanteric fractures, when the surgical treatment was not available, for some fractures of intertrochanteric femur fractures, it was tried, but it wasn't successful and it was discontinued and not done currently. So currently only it is done for humerus fractures only. Only that is also for humerus shaft fractures. Regarding classifications, whenever you are asked about classifications in your exams, you have to enumerate and describe any two classifications in details. If I have given 4 to 5 classifications, you did not remember all of them. At least two needs to be remembered in detail. And there were few suggestions regarding uploading the video on clinical examination of joints. I have discussed it with our seniors and head of the department, and the department is working on it, and which whenever it's ready, it will be uploaded very soon. Thank you very much.